The Health Minister says hysteria has gripped the profession and doctors have nothing to fear. He joined me in the studio. Minister, do you believe that doctors are going to resign over this dispute?
Well, firstly, I don't believe that there is any reason why the doctor or any doctor should have to take that particular action. Indeed, what we've agreed to in our discussions with Queensland doctors' representatives in the last couple of weeks address all of the issues which have been put on the table. Unfortunately, we're now finding that there are militant interstate union leaders, doctors' union leaders, who are trying to whip up a frenzy, and they don't want to resolve this issue. All of the issues which were put on the table have been resolved, and that's why only in the last 24 hours we have reached an arrangement with the state's most senior doctors that have got skin in the game, that actually work for the system, to actually move the required notice period back about 30 days so that they don't have to make any sort of precipitous decision that they may later regret.
OK, let's just work through those issues. Firstly, on the resignations, the Salaried Medical Officers Federation is saying they're in possession of hundreds of resignation letters ready to go. That's got to worry you though, doesn't it?
No, what we've got here is a union standover campaign which does not reflect what the rank and file hard-working doctors in Queensland really want or really believe in. They certainly are most dismayed at the way that these interstate union bosses are dealing with these issues. This is the worst sort of militant unionism. It's only designed...
But these are actual doctors writing the resignation letters, not the union people writing for them.
But they've got the union people that are out there misleading, misrepresenting, and interstate union leaders, doctors' union leaders, these militant leaders, they don't lose their job out of this, and that's the important thing for people to remember.
We're speaking to doctors and we're told by doctors that they will resign and that it will substantially affect regional hospitals around the state. Are you worried about the effect on patients and healthcare services?
Well, there is no reason for them to take those steps. I mean, if the unions were honest and honourable, then doctors would not be concerned.
But I was just talking today to one of the negotiators, and it seems like there are still sticking points.
Like which?
Rostering and fatigue arrangements. Rostering, for instance, there's a case where the managers, this new contract system will make the managers more responsible for the rostering. They're concerned that it affects patient care. For example, if you've got a trainee and a consultant on during the day, they want to move that trainee away from the consultant to work on night shift, therefore reducing the amount of training that trainee actually receives.
Well, let's look at the inflexibility of the current system, and we could actually look at what the Auditor-General said about the inflexibility of the current system. The Auditor-General also said that the way that our hours are rostered does not meet patient care needs. The 4 10-hour days actually seem to be worked on Monday, Tuesday, Wednesday, Thursday, yet the patient need on Friday is just as much, and we don't have the doctors rostered on, and then we have an extraordinary implication for overtime.
On the ground, though, there seems to be a disparity in power, because we're also being told, for instance, in the KPIs, the key performance indicators for these doctors, we're hearing anecdotally that, for instance, one chief executive says, oh yeah, it's going to be by agreement, but we will decide what agreement means.
No. Look, I mean, again, what we've got is anecdotes, rumour, innuendo.
But would you concede that doctors are worried that what you say in theory may not be what happens in practice?
Well, what we've had to date under the current system is a system which has let down Queensland patients. And what we need to do is to be more flexible. We've had a system which has been inflexible. And again, a lot of the things people...
But is it also about saving money?
No, it's about, we've got to make sure we always have value for money. It's about, as the Auditor-General also said, we need to start to look at what we do with our money, not just what we purchase, not just how we pay people. And I think that's fair, because businesses do that every single day of the week. It's not inputs, it should be outcomes. But
and
look,
that's fair enough. You want to get value for money, but the concern then becomes, is the focus then on saving the money and therefore putting the power in the hands of the business managers, or is it about patients and the power should be in the hands of the doctors? No, and that's the conflict.
This should be about the patients. It should be about quality, and it should be about value for money, making sure we get the right amount of services for what we spend. Let's not, do away with the fact that many of our chief executives are doctors and nurses themselves. The people who are their clinical leads are generally doctors or nurses. Now, no one is about wanting a bad outcome for a patient. We actually have in place now some of the most extraordinary processes of quality and oversight that you could ever imagine for in any health system, and that ensures that we monitor patient safety regularly. So those issues, once again, we're hearing about anecdotes, rumour, innuendo, and the unions are feeding that, and it's not true. These KPIs are by agreement. That's what we've done. If you don't agree to the KPIs, then you can't actually be expected to commit to them. So they're by agreement. And the other thing, of course, with the KPIs is that we've agreed to actually push out to the middle of 2016 any assessment of those for reward pay or otherwise. So we have an opportunity to see how they operate before there is any implication for the clinician.
Okay, Minister, thank you very much for your time. I appreciate it.
Thank you very much.